Sanfilippo Syndrome, or MPS III, is an autosomal recessive genetic disorder. It affects about 1 in 70,000 children. It is part of a group of disorders called mucopolysaccharidosis, known more commonly as MPS. Western European countries, such as the Netherlands, Germany, UK, Northern Portugal, Northern Ireland, and Greece, have the highest rates of Sanfilippo syndrome in their populations, but countries such as Australia, Canada, and British Columbia, the United States, and Utah, and Taiwan also have high rates on a worldly basis. Minnesota, Florida, Illinois, Washington, California, and Texas are the states with the highest rate of Sanfilippo syndrome in the U.S. Neither gender has a higher or lower chance of getting this disorder. All MPS disorders develop during the childhood years. Death occurs depending on the severity of the symptoms of the disorder, but usually around the teenage years between the age of 12 and 20. The symptoms include decline in learning ability, below average height, deteriorating mental status, behavioral problems, coarse facial features, chronic diarrhea, full lips, a unibrow, sleep difficulties, stiff joints that may not extend fully, and walking problems. Between the ages of 2 and 6, in the preschool years, children begin to fall behind their peers in terms of development. This is usually the time when they are diagnosed. The IQ of people with Sanfilippo syndrome is usually around 50 or below. Behavioral problems can be due to neurological issues, which gives them a lack of understanding, difficulty communicating, or sensory limitations. This can be accompanied by restlessness, overactivity, and fearfulness. Diarrhea can be a difficult problem because some children with Sanfilippo syndrome cannot control their sphincter muscles, so it is hard to potty train, and there is no specific way to change diet to prevent it. Sleep difficulties and disorders are most frequent from the ages 3 to 5 due to hyperactivity and restfulness. Stiff joints may not extend fully, which makes it difficult to walk. Also, as children get older, their mental and physical abilities devolve, resulting, for example, in learning to walk and then losing that ability so they can no longer walk. Sanfilippo syndrome is diagnosed by a physical examination where the liver is swelled, an eye examination where the corneas are clear, neurological testing that shows medical retardation and seizures, or a large amount of hairpin sulfate in their urine test can indicate the appearance of the syndrome. Additional testing includes blood culture to detect infection in the blood, echocardiogram, a sonogram of the heart, slit lamp eye exam to detect a clear cornea, X-ray of the bones to detect stiff joints, and skin fibroblast culture to detect if the person has a disorder or is a carrier. Sadly, there is no treatment currently, but money can be donated to find a cure. Because it is a recessive autosomal genetic disorder, there is a 1 in 4 chance that children of 2 heterozygous parents could have the disorder. This shows how it is passed down. Because delayed development and neurological damage are 2 major effects of Sanfilippo syndrome, we decided to focus on the central nervous system. This diagram shows the parts of the brain and the spinal cord, the 2 components of the central nervous system. The cerebrum has 4 lobes that control thoughts and actions. The frontal lobe controls reasoning, planning, movement, and emotions. The parietal lobe also controls movement and recognition. The occipital lobe is associated with visual processing, and the temporal lobe controls perception and recognition of auditory stimuli, memory, and speech. The parts of the brain that are affected by Sanfilippo syndrome are the olfactory bulb, cortex, thalamus, and amygdala. Especially in MPS IIIB, the, quote, endothelial cells and other cells compromising the blood-brain barrier are damaged, resulting in vascular leak, unquote, says Dr. Garbuzova Davis. She and her coworkers identified damage in brain structures specifically from MPS IIIB by using mice as models. They discovered that capillary endothelial cell dysfunction could accelerate neuropathological changes in the disorder by letting blood substances enter the central nervous system. There is a barrier responsible for protecting the brain from blood-borne substances and is greatly damaged by MPS IIIB. As stated earlier, there is no known treatment for Sanfilippo syndrome. Instead, Medical treatment goes to treating the symptoms, like stiff joints, hyperactivity, and sleep problems. Stiff joints can be waylaid by physical therapy. Neuroleptics, antihistamines, antidepressants, and melatonin can be prescribed for sleep difficulties and hyperactivity, but many families quote from experience that the medications do not really help much. Neuroleptics and antihistamines attempt to help with hyperactivity because in normal situations they work as sleep medication. In this situation, they attempt to calm. Antidepressants and melatonin are used to treat sleep disorders. Instead of using these medicines, or if they don't work, they try to have their child in an uber child-proofed environment, including locking the refrigerator, avoiding tables with dangerous corners, and putting gates on stairs, much like if there is a toddler without MPS III in the house. This method does not have a direct effect on the body system. Instead, it makes life more comfortable and easy for the child with Sanfilippo syndrome and their family. Thank you for watching our presentation, and remember, never make fun of a person with a disorder, no matter what. Thank you!